retour parmi nous, and welcome back. Our first set of concurrent sessions focuses on how COVID-19 has impacted various sectors and how we can work together to support recovery. The tourism industry is stronger together. Merci de nous joindre à nous pour cette séance de débriefage sectoriel. Nous sommes heureux de présenter cet ensemble de séances simultanées qui mettront l'accent sur les répercussions de la COVID-19 sur chaque secteur ainsi que sur la façon dont nous pouvons travailler ensemble pour soutenir la relance. We are very grateful to the Toronto Star for sponsoring these sector debriefs. Bonne séance, and I'll see you again at 12:45.
Thank you, Catherine, for that introduction. Health and safety of passengers and employees is central to everything that airlines do. Since the spring, tremendous work has been undertaken by Air Canada and WestJet to implement new procedures and regulations to continue to protect employees and passengers during the pandemic. These measures are proving quite successful. As Canada's Chief Public Health Officer, Dr. Theresa Tam, noted last week, there have been very few incidences globally of the virus being transmitted during flight. For our session today, we have Dr. Jim Chung, Chief Medical Officer at Air Canada, and Jared Mikash-Gurki, Senior Manager GR and Regulatory Affairs at WestJet. So gentlemen, we don't have a lot of time, so I think I'm just going to jump right into it with the questions. Both your companies have undertaken a lot of work to develop your respective biosafety programs. I'll begin with Jim and then to Jared. Can you tell us a little bit about the overall approach that Air Canada has taken, the research and engagement with the medical community and others in developing your corporate biosafety strategy?
Great. Thank you, Mike. At Air Canada, I'm proud to say we have been very proactive in advancing biosafety throughout this pandemic through our Clean Care Plus program, which covers all the stages through the customer journey. This includes touchless check-in, being the first airline in North America to use temperature checks in early May, provisioning of care kits, including hand sanitizer and masks, and use of hospital-grade disinfectants and electrostatic sprayers throughout our cabins. Our engagement with the medical community predates this pandemic, and I would like to highlight our partnership with Blue Dot, an artificial intelligence health company, whom we have been working with for the past year and a half, that help us with an early warning system of potential disease outbreaks. Blue Dot was one of the first organizations to flag and highlight the risk emerging from Wuhan, China, from a SARS-like respiratory infection. This helped Air Canada with getting ourselves prepared at the time in case this were to progress further and anticipate next locations for risk of transmission, as well as review our pandemic protocols. Since then, we have been proactive in both research and further engagement with the medical community. We have been working with the Cleveland Clinic to assist us with our COVID efforts since July. Our Pearson study, in collaboration with the GTAA, McMaster University, and the University of Toronto, launched September 3rd, the first of its kind in collecting real-world data on international travel risk. Air Canada is also working with the Creative Destruction Lab's Rapid Screening Consortium on testing, contact tracing, and other technology to assist Canadian employers. This consortium is made up of large organizations representing a diverse array of industries in addition to the University of Toronto. Personally, I'm a member of the IATA Medical Advisory Group, which has been very active and focused on COVID. And I also sit on the Health Canada Industry Roundtable Advisory Group on testing, as we look forward to the next phase of the pandemic, as new forms of testing technology become available, and how they may help mitigate the pandemic and restart the economy.
Thank you, Jim. Jared, over to you.
Thank you, Mike, and TIAC for hosting us today. It's an honor to be here. I think it's valuable to give some context on how far we've come since the beginning of this. We go all the way back to when this pandemic started, and we began to envision how it could have an impact on aviation. However, I don't think we really appreciated to what scale or how significant it would be. The first signs of impact was domestic aviation in China falling off the map, and once it spread to Italy is when we really started to feel it here. When President Trump imposed an executive order restricting any person who had been in hotspots not to enter the United States, air carriers were given a regulatory mandate to refuse those travelers at all points of entry into the United States. We were given just 72 hours to implement manual procedures. As one of the largest markets into the US, this was a significant task, but it was the first insight into what was to become one of the most challenging and state individualized regulatory regimes we would see since the 2001 terror attacks. As soon as that happened, we realized we needed to have a cross-functional corporate strategy to manage this crisis. and the biosafety measures that were to follow. We instituted an instant command structure with senior leadership from every part of this company. For nearly the first 50 days, we met every single day between 1 and 3 times daily, holiday and weekends included, to make thoughtful and informed decisions about how to manage our business and discuss what measures we needed to take. Today, still, that original group continues to meet twice weekly. We've engaged with all levels of government at a deeper level than we have previously. We've researched best practices around the world and undertook reviewing gamuts of medical research as it came out, and quickly engaged all of our suppliers to ensure that we had a long outlook stock of medical and cleaning supplies. The easy part, though, was that our business revolves around safety. Every decision we make is through the lens of safety first, so this was merely an extension of that. We know our obligation is to make our guests know they are safe, and that's why we've implemented a range of health and safety measures continuously throughout this pandemic, and many without regulation. From electrostatic disinfection to temperature checks on all flights, and engaging in testing trials and partnerships with medical institutions, we do continue to push the norm, and we do everything we can to make sure our guests have confidence in the safety of air travel.
Thank you, Jared. So I'm going to come back to you, Jared, first for this next question. So as you've implemented the myriad of new procedures, as you said, you had to do it all quite rapidly over the past couple of months. How have these changes been received by the traveling public? And what steps have you had to take to ensure passengers are informed, not just of the new procedures, but of course their obligations under government regulation?
You know, Mike, a myriad is certainly the correct term. Since the pandemic started, we've introduced over 20 health and safety protocols for our guests, for our people, and on board our aircraft. We've been very attentive to what our guests have been saying, and since the beginning of this, health and safety related questions came to the forefront of all of our post-flight market research activities. This has given us a good pulse check on how our guests feel, and the general sentiment has been overwhelmingly positive, especially with the cleanliness of the aircraft and the measures we have taken to give people comfort on board. Naturally, all decisions weren't immediately popular. If you think of when we removed the seat distancing on board, however, that's a great example of how this crisis has evolved. What originally looked like something more on a short time frame, it became apparent that this is going to be with us for some time still. So we needed to evaluate the economic impact of flying planes with less people, which would result in much higher ticket prices versus what other measures we could implement in place of that. This wasn't an off-the-cuff decision, though. It was thoughtful and science-based. Mandatory masks, temperature checks, health screening questions, significantly enhanced cleaning protocols, reduced touch points, and active HEPA filtration on board the aircraft balance out the need for social distancing. And I think that Dr. Tam's statement the other day is really a testament that we are truly making science-based, informed decisions to reflect our continued commitment to health and safety.
Thank you. Jim, same question to you.
Sure, thanks, Mike. I believe Canadians are very well informed on measures required for air travel. Measures that are required to enhance the safety of the traveling public have been well received generally. The measure which has been the most challenging, though, as I'm sure Jared will agree, is mask compliance. And I suspect not as politically charged as down south, there have been challenges which are well documented in the media with cases of mask wearing refusal by industries, or by individuals. Biosafety is a multi-layered strategy, and the risk of air travel is very low if these multiple layers of safety are employed. And mask wearing is one of the cornerstones of this risk reduction, as evidenced in recent research and publications.
Thank you, Jim. I'm going to start this next question with you. So as work continues on the best means of dealing with the virus, what steps is Air Canada taking to remain current on these new developments and research that will further enhance protection of passenger and employee safety?
We are staying current through our work with the IATA Medical Advisory Group and our relationship and work with the Cleveland Clinic and Blue Dot, and also our involvement with the Creative Destruction Labs research, as well as our work with various governmental ministries, including all the recent developments, really in terms of testing, therapeutics, and vaccines, of which we are staying on top of.
Thank you. Jared, same question.
Yeah, similar to Dr. Chung, we've stayed very close with IATA. Additionally, we've also been evaluating absolutely every health and safety technology and system out there. We've had supplier days where we brought in important decision makers within our organization to evaluate what we can implement to improve our response as the science evolves. What I can say is that this pandemic has made our decision making and procedures much, much more agile and responsive than they ever were before. This gives us the ability to evaluate new research, new technology, or process applications in a much faster manner and allows us to respond to the ever-changing regulatory requirements better. We have dedicated teams who are responsible for evaluating new developments and understand where or if they fit into the business, and if so, building policies and procedures to ensure we can support quick implementation.
Great, thank you. And before I go to the next question, I'll just let you both know, like the good airlines that you are, we're probably coming in a little ahead of schedule here. So we we can take a little bit more time with our answers if you want, or else I'm going to have to hit you with questions out of the blue. So going to going to the fourth question. You have both launched important testing pilot projects, Air Canada with the GTAA at Pearson and WestJet with YVR in Vancouver, and the most recent Calgary International Airport pilot project announced earlier this month involving the Alberta government. Can you each provide an update on those programs and what you're hoping to achieve with them? And Jared, I'll put it to you first.
Sure, Mike. Yeah, this is a really exciting space right now. And it's also evolving and changing very, very quickly. I'll perhaps start with the Calgary pilot before I move on to the Vancouver study. In Calgary, what I believe is the product of great collaboration between the provincial and federal government is the very first sanctioned trial that implements testing on arrival and continuous contact in place of the mandatory 14-day quarantine. This is really an incredible achievement and a great example of strong collaboration amongst all parts of industry, public health sector, and all levels of government. We see the 14-day quarantine as a massive barrier to getting our industry back on its feet. And with this trial, reducing quarantine from 14 days to as little as 2 with a negative result, it provides some life back into travelers who really want to travel again, but doing so in a safe and science-based manner. Now, it is a pilot program, which allows the results to be tracked and gleaned before it's expanded, but the initial results are very positive. To date, nearly 2,000 people have enrolled, and we've worked with the government and airport on process to make it seamless to our guests. One of the first green shoots we've seen from this is that it is indeed having a positive impact on demand, which has generally been flat for the last many months. We've had the opportunity to be able to cycle through some of these processes and really understand what that looks like in an airport environment. Implementing something like this of such scale, it's never been done before, comes with its challenges inherently. And we've got a lot of learnings that we're taking away from it, but I'm a huge advocate for it, and I think we're really hopeful that we can see this expand into other jurisdictions and other airports across the country.
Thank you.
Shifting to the Vancouver trial, perhaps before. This will be a trial of rapid antigen tests pre-departure for any of our guests departing from Vancouver on a domestic flight. We're expecting to launch this on the 23rd of November, and guests can volunteer for a free test before they travel. We'll get the results back in 15 minutes, so this will be the very first trial where we can get perspectives on how rapid testing fits into the departure process in an airport environment. It will also give us an indication of the consumer's willingness to voluntarily be tested before travel. The other exciting part of this is that it's an antigen test, not a diagnostic or a PCR test. So really, it is identifying any contagious travelers and keeping those ones off of airplanes. Not those that might have had it before it was contagious or afterwards. This is truly, it's a solution I think that is well suited to our sector in the sense that it focuses on those that are at the highest risk during their travel. And it's also far more scalable and cost effective. When comparing to a PCR test, it averages $5 to $10 a test versus $150 to $400 a test for PCR. So this gives us an opportunity between the two to have one trial on arrivals that allows us to be able to reduce quarantine, and then another trial on the departure side that allows us to see what it looks like as part of the departure process, where we've never had it before. And as we see a number of jurisdictions that have obligations for testing prior to travel, this gives us a good sense of what that implementation looks like, and also what the consumer or the guest would experience.
Thanks, Jared, and good job not being cut off when I waded in too early to segue to Jim. Well done. So Jim, same question in terms of Air Canada's testing activity as well, please.
Sure, thanks, Mike. And just to build on what Jared has mentioned, we should take a lot of pride in how these studies have been complementary, essentially, and collaborative, and how they build on each other, though. And certainly, just with respect to our Pearson study, actually, the Pearson study finished recruitment on October 31st, and today was the last day of sample collections. I'm pleased to say that we have reached our goal of over 10,000 participants who have provided day 1, 7, and 14 samples. And we've collected and analyzed over 46,000 samples in total from all participants to reach a statistically significant number. There will be an upcoming interim report released this week, which will have more detailed information than our first interim report. And this report has already been shared with various governmental ministries, both at the federal and the provincial level. And we hope that this will help inform further policy, much like the Calgary pilot project. I just want to add that I'm so proud of all the team members who spent countless hours getting the study up and running, given the complexities, as Jared will appreciate, on what was a very short time frame from conception to implementation. And I really think that speaks to the importance of this study, as well as the Calgary study, and as well as the Vancouver study, to getting that buy-in and the groundbreaking research and data that these studies provide to help inform policy.
Thank you, Jim. In each company's ongoing work and research, are you seeing examples of work underway in other countries that you would like to see emulated here in Canada? And Jim, I'd like to begin with you first, please.
Yeah, interestingly enough, Mike, I mean, a lot of other countries are looking, and other airlines are looking at the work that we're doing, since our work is, quite frankly, internationally groundbreaking, and they're always asking about our results and our interim reports. So I think we could take some pride in that. But we can always share best practices when it comes to safety, Mike. There is no monopoly, and through our work with IATA, the medical advisor group, and really working with other airline medical directors, there's a very good and free flowing exchange of ideas and best practices. I think we in Canada do have comprehensive biosafety measures in place. And really, I look forward to the next phase, which is really looking at testing and how to best utilize testing in the aviation sector. And we can look at countries and areas such as France, Germany, and Italy that are already using rapid antigen detection tests or diagnostic tests for flight screening, for example, and see how those outcomes are.
Thank you. Jared?
Yeah, Mike. Absolutely. I believe that there is a lot of the work that we are doing here in Canada is truly industry leading. So I do echo what Dr. Johnson said with that. I believe that there's also a lot of other good work happening in other jurisdictions we can learn from. Sharing best practices and throughout industry and throughout states is really, really important for a time like this. Germany has done a really good job of scaled implementation of testing, and we're seeing a number of markets that are cautiously opening up using testing as a means of quarantine. Hawaii is one of those markets, as is a number of other Caribbean markets that understand that tourism and economic development is very, very important to those markets, as is the maintaining the balance of the public health stream. Those are proving to be very effective in balancing the teeter-totter effect in those places. And building on what Dr. Chung had said, I think that as we look to all of those testing mechanisms in places and other streams of work that helps reduce quarantine, as long as we can balance out the public health stream and the economic benefit that air travel in our sector brings, I think that's really, really crucial. We continue to look at all of those industry leading measures and sharing information amongst IATA and other partners to make sure that whatever is happening that shows some promise or some success, we can hopefully bring into Canada and emulate and understand what the policy implications of that would be.
Thank you. And on my notes, this is the last question, but I think we might have a little bit of time for a rapid series. So we'll see how that goes. So theoretically, the last question, and Jared, I'll begin with you. What overall message do you have for the travel and tourism community as far as biosafety in aviation?
Come and see it for yourself. I think that this pandemic has really scared a number of us, and rightfully so. It's been an extreme period of learning and challenge, and it's impacted this industry and this sector heavily. But I assure you that once you get into an airport and on an airplane and see and feel the significance of these health and safety measures that are broadly implemented, I promise you that you will feel safe. This is the new normal for all of us. So I really, really do encourage you to reach out of your comfort zone and experience it. It's a lot different than just reading our websites, reading the media, seeing what we've implemented on our social channels or anywhere else, or listening to me talk about it. And the true benefit is it will bring back that incredible feeling that travel gives us all. I'd be honored to welcome anybody on board.
Thank you. Jim, your views?
Thanks, Mike. I really think, just to reinforce our message, that measures should be science and data driven. and that the incidence of onboard transmission is extremely rare, as Dr. Tam recently noted in her press briefing. And as you're aware, Mike, the most recent data and research published by Harvard and also by the U.S. Department of Defense in collaboration with the University of Nebraska, in assistance with United Airlines and Boeing, really reiterate that point, that the risk of onboard transmission is very low.
Thank you for that. And good points by both of you. We do have a few extra minutes here before we throw it to commercial break, I think is the vernacular on TV. So I'm going to come up with a couple of off-the-cuff questions for both of you. And Jim, I'm going to start with you. So we were chatting just before we started this session about how things are very different in the world than what any of us anticipated entering 2020. And you had commented on the degree to which you've now become a bit of a media, well, you didn't say media darling, but I'll say media darling. I wonder if you could just chat a little bit about how your role perhaps has changed, your engagement with stakeholders and others that perhaps was not standard par for the course before the pandemic, and how, of course, your medical training and being chief medical officer is obviously helping you help Air Canada chart the path forward.
Well, thanks, Mike, for that thought, and maybe just my thoughts on this as this evolves are not just for Air Canada or the industry. It's really, I mean, just really for Canada or the U.S., for example, in that employees in general, not just for Air Canada, but I'm sure for WestJet and other industries, are looking for more reliable sources of information. The problem with information overload, and certainly with the alternative sources of information, make it very challenging to getting the adequate and truthful information out there. And so it's interesting that my role has really evolved into being more of a communications type of role, and in that education, that communication point was something that probably wasn't there, not just for myself, but for various other medical directors that I converse with. That it's an important, it's really has been emphasized, and it really has become an important role for the medical directors to be able to communicate and provide the most up to date and information from reliable and trusted sources. And so that is a challenge, I guess, in the new internet age, and certainly with Twitter and Facebook and what have you, and disinformation. And that's been probably one of the biggest challenges, really.
Thank you for that. And Jared, you've obviously got a ton of experience from a regulatory development perspective, regulatory compliance perspective for WestJet. Obviously, with the pandemic, things have changed somewhat in terms of the speed and the scope of regulation that's coming down the pipe, and engagement with government in developing that regulation. So just in terms of the past 6 months, having that regulatory role in such a highly already regulated industry, just wondering to what degree your experiences prior to 2020 have helped you in terms of managing the deluge of changes that are coming, and also whatever changes and structure you might have had to set up, perhaps to some degree on the fly, within the airline to stay abreast of these reg changes and ensure not just compliance, but also training for frontline, communications engagement with the external communicators, and your engagement with your partners such as the airport authorities.
Yeah, thanks, Mike. It's been unbelievably challenging. The regulatory environment, as we've watched throughout this pandemic, has shifted multiple times, very rapidly, and continues to on a state-by-state level. The one interesting part about this versus kind of other incidents in the past that have had regulatory reform as an associated element to it. If I'm thinking like the 2001 terror attacks and other security type instances where there's an event that requires regulatory change in order to reduce that. We've seen some flux in the sense that in jurisdictions that might have a high caseload and then kind of falls down and starts to flatten out, there tends to be a relaxation of some of those regulatory requirements. And then as it comes back up, they're reinforced, and sometimes differently based upon how the science has dictated what that looks like. So it's really required us to be very, very agile in terms of how we're responding to these, not only from a network perspective, but from a process perspective, a training perspective, and communication perspective. So probably one of the most fundamental changes that's got us through this was the development of the implementation of our incident command structure. That really gave us the opportunity to make sure that we have a number of different stakeholders across the organization so that when regulatory changes come through that are impacting our business, we can respond accordingly. A lot of those changes have come through with very reduced timelines and very kind of quick implementation periods that ranges from immediate to a few days out. So we've really had to make sure that we have strong, robust processes in place to make sure that any of training that goes out, any procedural development that goes out, communications and digital support is all very, very well tied together. My history, kind of where I came from prior to this, was in the aviation security sphere. So understanding that from a regulatory implementation perspective has given me, I'll say, a leg up in dealing with this pandemic and dealing with how we actually implement and respond to some of these measures. But it's really not a lot different to how we've responded to security events in the past. From a biosecurity or a biosafety perspective, really what we're looking for is how we move through this and make sure that we can restart effectively. International harmonization is going to be incredibly important. So we look to ICAO, we look to WHO, and we look to IATA. We've increased significant advocacy efforts to make sure that whatever these regulations look like, as best possible, how do we harmonize them across different states so we don't have a really big mishmash of different regulatory requirements that are imposed on us and make that more complex for the consumer. Ultimately, if consumers are traveling to India or if they're traveling to Hawaii or if they're traveling to London, they should be able to anticipate very similar measures and not necessarily be confused. So it's a maintenance of really reflecting and refining our procedures and working significantly with our government partners to make sure that we can balance out what this looks like and what the next 6 months looks like. So short to medium term, it's challenging, but we hope to see some promise along.
Excellent. Well, look, I want to thank both of you for giving us the time today, and in particular the unscripted rapid round questions. I actually had about 5 or 6 more that just came into my head, but I have seen that we got the 1-minute warning here before shutdown. So again, I want to thank both of you for your time and giving us all an insight into not just the complexity, but the commitment and the degree of effort and investment and bandwidth that has gone in by the airlines in meeting this challenge and ensuring that ultimately, as we said at the outset, every action that is taken is ultimately ramping up back up to protecting passengers and employees, their physical well-being, their health during the pandemic. And I also want to thank them also for today's session and giving us the opportunity to have this chat. And hopefully I will be able to see both of you in person at some point in the near future. So thank you to both of you and thank you to TIAC.
Wonderful. Thank you very much.
Thank you.
Thank you for joining us. Did you know that networking continues even after the end of today's sessions? Don't forget to save time to catch up with your colleagues from coast to coast to coast. N'oubliez pas de réserver du temps pour vous rattraper avec vos collègues d'un océan à l'autre.